Hello! Welcome to In the Den with Dr. Jenn, an open-minded and unique place to explore sexuality in a holistic manner and start thinking about female sexuality outside the box. Okay, this Den Chat topic is a topic that kind of upsets me. The G-shot. If you recall from session number 36 of In the Den with Dr. Jenn, this was the topic of the sexual fun fact. But I want to go into more detail about this topic as there's so many important nuances to address. So in a nutshell, the G-shot is an injection of a human-engineered collagen into the G-spot area, performed by a doctor, with the intent to increase the size of the G-spot. The theory behind this is that, therefore, it makes it easier to stimulate and presumably increase pleasure. It lasts for about 4 months. Results do vary. And from what I've read, you have to be able to locate your G-spot first to be able to stimulate a little bit to indicate where the shot should go. It's performed as a lunchtime procedure or at G-shot parties. All right, you know I am all into female pleasure. However, this is not an FDA-approved use of collagen. It's invasive. There's needles being inserted into the vagina. There's no double-blind, placebo-controlled published studies on this procedure. You know, all of our knowledge around the G-spot in the past 25 years has been intended to validate the experience of some women, not to create a new goal, a new pressure to perform. And I have issues with anything that seems to reduce women's sexual pleasure to a mere physical change, as if other factors of mental, emotional, relational are not hugely relevant. And this is part of the increasing medicalization of women's bodies and labeling every single part of the body, outside and in, as inadequate and needing to be improved medically and surgically. And that's the dirt from the den. Sexual fun fact number 775. True or false? Gynecologists prefer when their female patients are well groomed and waxed in their genital area. Well, it's on my show, so you probably know the answer. False. Do you know how many vaginas and vulvas they see every day? They're there between your legs to see if anything looks out of place and do a pap smear, not to judge you on your bikini line or leg hair. And I'm pretty sure they know that hair is natural. They just prefer that you be clean. The Den recommend. Do you struggle with having orgasms? Have you heard the recommendation to just relax? Well, this isn't really the best advice, or at least it's really only part of the picture. Relaxation is important. Not letting stressful or distracting thoughts take over, staying present in your bodily sensations, or perhaps your connection with your partner, or perhaps the images of a hot fantasy.
Next week, Batman faces the Catwoman.
Okay, but I digress. So yes, relax yourself mentally and emotionally. But in terms of physically, a bit of tension is actually helpful. Tightening those PC muscles in your pelvis, your stomach muscles, perhaps your thighs. This kind of tension when you're building to orgasm may be necessary to build up those muscle contractions that make up an orgasm. So what's your perfect balance of relaxation and tension? What's that word? Idioclitric. What's that word? Okay, this might not actually be a real word yet, but this was created by a member of the Den. Idioclitric is the unique way that many women have to masturbate in order to reach orgasm by themselves. And I would add to that how unique overall it is in the way that each woman reaches orgasm. So do you have your own sexual word that you think should be a real word? Join the Den forum discussion about creating your own sex words here. Oh, I think I just found my perfect balance here of relaxation and tension. Nice. Visit me at DrJennsDen.com or email me at Jennifer@DrJennsDen.com. And if you want to see this show continue, then spread the word. We're looking for donations and sponsors to be able to keep doing what we're doing here at Gorilla Soapbox. And the more viewers we have, the happier everyone is sexually. So what are your idiosyncrasies? Be kind to yourself. Oh. Can you catch him? I want to try to catch one.
Ow! Ow!
Yeah.
Don't blame me if it hits you.
Okay. God! Holy shit! Were you shooting for cleavage? And it's so funny, I'm all, totally miss it as it hits my cleavage.
I get stuck right in there too.